Hello and welcome. Today, we'll be exploring a condition that affects the lining of your lungs, pleuritis, also known as pleurisy. We'll delve into what causes it, how it affects your body, and what you can do about it. Pleuritis isn't a disease in itself, but rather a symptom of an underlying condition. The most common culprit is a viral infection, like the flu or a cold. Bacterial infections, such as pneumonia, can also lead to pleuritis. Less frequently, it can be caused by fungal infections, autoimmune disorders like lupus or rheumatoid arthritis, chest trauma, pulmonary embolism, certain medications, and even cancer. To understand pleuritis, imagine your lungs are nestled within a sac made of two layers called the pleura. These layers are normally separated by a thin film of fluid that allows them to slide smoothly against each other as you breathe. In pleuritis, these layers become inflamed and irritated. This inflammation causes the surfaces to rub together, like sandpaper, with each breath you take, resulting in the characteristic sharp chest pain. Pleuritis is a relatively common condition, especially as a complication of respiratory infections. Because it is typically secondary to another illness, its exact incidence is difficult to pinpoint. However, it's seen frequently enough in clinical settings, especially in conjunction with conditions like pneumonia, viral infections, and autoimmune diseases. Anyone can develop pleuritis, but those with underlying health conditions or weakened immune systems may be at a higher risk. The hallmark symptom of pleuritis is a sharp, stabbing chest pain that worsens with breathing, coughing, or sneezing. The pain is often localized to one side of the chest. You might also experience shortness of breath, a dry cough, fever if an infection is present, and rapid, shallow breathing as your body tries to minimize the painful movement of your chest. Diagnosing pleuritis typically involves a physical exam where your doctor will listen to your lungs with a stethoscope. A grating sound, known as a pleural rub, is a telltale sign. A chest X-ray can help identify underlying conditions like pneumonia or fluid buildup in the pleural space, called a pleural effusion. Further tests like a CT scan, blood tests, or even a thoracentesis, where fluid is drawn from the pleural space for analysis, may be necessary to determine the root cause. While pleuritis itself isn't categorized into specific types, it's important to differentiate between dry pleurisy and pleuritis with pleural effusion. Dry pleurisy refers to inflammation without significant fluid accumulation. When fluid does accumulate in the pleural space due to the inflammation, it's considered pleuritis with pleural effusion. The presence and nature of the effusion can provide valuable clues about the underlying cause. Treatment for pleuritis focuses on managing the pain and addressing the underlying cause. Pain relief can be achieved with over-the-counter or prescription pain relievers. If the cause is a bacterial infection, antibiotics will be prescribed. Antiviral medications may be used for viral infections. For autoimmune-related pleuritis, treatment often involves anti-inflammatory drugs or immunosuppressants. In cases of significant pleural effusion, a thoracentesis may be performed to drain the fluid, providing relief and allowing for further analysis. Preventing pleuritis largely depends on preventing the underlying conditions that cause it. This includes getting vaccinated against the flu and pneumonia, practicing good hygiene to avoid respiratory infections, managing autoimmune disorders effectively, and avoiding exposure to lung irritants like smoke and pollution. The prognosis for pleuritis is generally good, especially when the underlying cause is identified and treated promptly. Most people recover fully. However, untreated pleuritis or pleuritis related to a serious underlying condition can lead to complications such as empyema, which is a collection of pus in the pleural space. Recent research is focusing on developing more effective and targeted therapies for autoimmune-related pleuritis and exploring new ways to manage pain and inflammation associated with the condition. Thanks for watching, and we hope you found this informative.